in terms of AI, where do you see health systems being aggressive? And we use the broad term AI. You define it
Right.
as you want to see fit.
Yeah. Again, I think the differentiator is there's lots of machine learning going on. There's lots of NLP that is really starting to break out, but the reasoning and planning are the big differentiators. And that's where we're not necessarily seeing as much as you might expect. But really, a lot of these components of AI are honing in on cancer detection and navigation. I don't think we're really mainstream with a lot of imaging components with cancer detection. There are pockets of that, but it's not mainstream yet. The navigation side and ability to pull the text and different components of what's in a patient's chart to aid and help certain chronic disease management, especially cancer navigation. We're starting to see that more and more. There's a lot of companies that do that. But I would say the biggest aggressive push right now would be in the coding front. So leveraging the different elements of AI to be able to understand patients' conditions and ability to give the right code at the right time to the provider to select. So inferring suspect conditions, validating conditions. This is where there's been a lot of push, and this is where the need is. And I think a lot of that is driven by really hard ROIs that are seen instantly. The payers are happy with that because they're getting the right code, and the providers are happy with that because they're getting the right code. At the end of the day, you want the true clinical picture for patients. So leveraging technology to help your clinical documentation improvement specialists, help your coders. Notice I'm not saying get rid of. This has been a huge push. I've seen this a lot in the last year.